Namaskaram. I am Dr. Sibasankar Dalai. I am the Chief of Neuro Vascular Intervention in Medicover Hospital at Venkojipalam, Visakhapatnam. We will discuss about something very, very common nowadays. We get a lot of patients who have liver cirrhosis, especially the alcoholic liver cirrhosis. So because of excessive consumption of alcohol, patient will suffer from the cirrhosis of the liver. So the liver get damaged and it becomes cirrhotic. Cirrhotic means it becomes very hard. And once it becomes cirrhotic, it does not allow the normal venous flow to go through the liver into the heart. And the liver, basically, once it becomes small, hard, it starts compressing the veins. Then you will see that the veins which were draining through the liver, they get swollen up, especially in the esophagus and the GG junction, and then in the rectum, and they start bleeding. That's why the patient with liver cirrhosis will start bleeding because of this esophageal varices. They can have duodenal varices, and they can have gastric fundic varices. They can have rectal varices. Varices means dilated veins which become thinned out and they have a propensity to bleed. That's why people who have cirrhosis, they will start bleeding from the mouth or from the intestinal system or in the rectum. So now, what is the treatment for liver cirrhosis? So the best treatment for liver cirrhosis is a liver transplantation. But sometimes you do not have a donor, or sometimes it is expensive, which you cannot afford. Then there is another procedure, which is a beautiful procedure, which is called a TIPS. So that is a transhepatic, the transjugular intrahepatic portosystemic shunt. So this procedure, the TIPS, otherwise we call it a bypass, I've been doing since 2006. So we do it plenty and it's quite commonly done. So we put a needle from the neck and go inside the liver, and from the hepatic vein, we just go inside the portal vein. We create a shunt, like a surgical shunt. We create an endovascular shunt without open surgery. And once we create the shunt, then basically the portal pressure, which is very high, they get very comfortably going into the heart. So this is called TIPS. This procedure is done in about 2 to 3 hours under general anesthesia, and we keep the patient for a couple of days. And this is a beautiful procedure. This can be a standalone procedure to handle the patient who are having cirrhosis, especially who are having emergency bleeding and large ascites, that is accumulation of lot of fluid in the abdomen which keeps coming again and again. Those patients are also suitable for TIPS. And especially patients who are waiting for a transplant, they can also undergo a TIPS. Subsequently, they can go for a liver transplant. So this is a very, very nice procedure called TIPS for cirrhosis of the liver and alcoholic or non-alcoholic cirrhosis. Both type of patient and even tertiary patient, they are basically suitable for undergoing this procedure called TIPS. Thank you.